Fantastic. Thank you so much, Dr. Rip and Dr. Pender and Anthony. It's amazing to hear about people doing some real work to improve physician burnout. That emphasis on community and self-care is important, but making physicians' jobs easier is something we talk a lot about. Now, in the world of digital health, this idea of making the physician's job easier has been talked about so many times, but there's very little evidence that all the digital health that we're putting in is significantly improving with evidence that we need to drive towards the future goals that our physicians need to fulfill. There's a lot going on with patients, direct patient care. There's a lot going on with telehealth. There's a lot going on with misinformation that physicians have to counter all the time. And it's really important to use some of these lessons that Dr. Rip, Dr. Pender, and Anthony have given us to really figure out from a digital health perspective, what can we do about burnout? We're not going to be able to make physicians' lives better because we can't change their hours that they work and the other things that are important to them for family and time that they spend with friends. But what we can do absolutely is try to use all of this technology to help reduce their workloads. So with that, hopefully you guys have gotten some good ideas. And next up, we have a great way to make physicians' job easier, making sure you have fully staffed and high quality nursing teams. So we're hearing a lot about nursing shortages, but what can we do to help? So CareRev has seemed to figure it out with this flexible on-demand staffing program. They've just rolled out with Providence Health in Washington State, and Will Patterson, founder of CareRev, and Mark Smith of Providence are here to talk about it now. Will, take it over.
Thank you, Shahid. I'm excited to introduce Mark Smith here, the VP of Workforce Strategy and Analytics over at Providence. Mark, thanks for joining us.
Well, thanks for the invitation. Sure, appreciate it. Really glad to be here today. I think it's a great topic. Just for background, as Will mentioned, I lead Workforce Strategy and Analytics at Providence. At our core with Workforce Strategy and Analytics, we believe our opportunity is to provide insights to the organization that help the organization and our leaders make their best decisions. And really, over the last 2 years with our pandemic and with the workforce crisis, it's probably never been more critical to provide insights. We've learned a lot about what's happening in the workforce and how we need to respond. And clearly, we've learned a couple of different things. First, what we know is hiring is not going to be the way out of crisis. Sounds counterintuitive, but that's just the reality. And that traditional agency models are probably not going to be able to help you with the supplemental staff that you really think you need today and going forward.
Yeah, let's talk about that a little bit. What made you realize that, the traditional staffing agency model, wasn't going to be something you're going to be able to rely on in the future? And really, what was the kind of aha moment when you realized you needed to change something with your workforce strategy?
Yeah, that's a great question. Well, let me speak about traditional agency first. Beginning in May of last year, as we were finishing up our first demand forecast at Providence, we were looking at our numbers for how we needed to grow. And at the same time, I was taking a look at our agency requests, and not only at Providence, but looking at nationally. And we were seeing that at that time, the agency requests across the country had increased about 132%. There were upwards of 40,000 agency requests across the country. But we also knew is that there were about 60,000 agency nurses available across the country. So we've seen this huge increase in the number of nurses needed and nowhere near the availability of agency nurses to fill all those requests. So it really told us that we were going to have to think about a different way to supplement our staff. What we also were looking at as we watched the workforce crisis is this proliferation of healthcare workers moving to the sidelines. Upwards of 500,000 healthcare workers have gone to the sidelines for a lot of different reasons. And when we started to look at that a bit more, what we realized is that traditional agency was not going to fill the opportunity that it once did, but there could be an overlooked surplus with those individuals who weren't working today.
Let's talk about that. What do you mean by sidelines? Like the 500,000 nurses that have left the field, was that by the way, was that in 2021, 500,000 left?
So really good question, Will. Since the pandemic began,
okay,
about 500,000 healthcare workers across the country have gone to the sidelines. From what we can ascertain from the information, many different reasons. Some are burned out, and burnout is real. Some are, feeling that the heavy load of workload, as others are leaving, the reward for staying is more work. And so that's moving people to the sidelines. There also is the element of the crisis around us. So while we see the challenges in healthcare, we also have adjacent industries where we see the challenge. So for example, daycare industry has really been hit hard by the crisis. Right now, I think we have close to 106,000 openings for daycare jobs across the country. And you think about it this way, those jobs pay somewhere between $12 to $14 an hour. Someone could go to McDonald's in some areas of the country and make $15 an hour and also get a $1,500 sign-on bonus. So, that the reality is that our healthcare workers have families.
mm-hmm.
If they don't have access to daycare, that really limits what they can do. We also know that we saw many healthcare workers go to the sidelines because they had loved ones who had medical conditions and needed care. So for many, many reasons, legitimate reasons, we've seen that. I think what we're also seeing in the crisis is that more in the workforce, healthcare and beyond, are looking for more flexibility. When we think about our traditional employment models, it's often that we ask caregivers to work under our conditions. And what the workforce is saying today is we want to have a little bit more balance in what those conditions will look like. So I think for all those reasons, we're seeing many go to the sidelines, and not just in healthcare, but it's significant to us in healthcare. 500,000 people is quite a bit.
Yeah, how many healthcare professionals are there nationwide? I think it's either, I heard the number of 18 million or 22 million. I think it's somewhere around there. I mean, that's a huge percentage of the workforce that's left.
That's right.
Yeah. And then of course you mentioned flexibility, right? And we've talked about this before. How do you attract the people from the sideline back into the industry? And I'm with you on that. I think flexibility for these folks, especially the ones that have children or folks they're caring for, is huge. So, over at Providence, what flexible workforce models are you looking to deploy?
Looking at many different opportunities, one of the first opportunities, and we think one of the most critical opportunities, is really looking at knowing that we have so many people moving to the sidelines who are really not interested in returning to a traditional employment arrangement. We're really thinking more about gig. And so how do we think about a workforce where we can actually look at our work as something that a person can bid for want of a better way to think about it, and really pick up shifts, portions of shifts in a way that is aligned to what they need right now. And so that's why CareRev has been such an awesome arrangement for us, because here we have this really great opportunity to tap into an overlooked talent surplus, 500,000 people, healthcare workers who have gone to the sidelines, who are saying, I can be available if you're open to a different arrangement. And so CareRev is doing a fantastic job of helping us really meet those folks in the middle, get introduced, and find out what can work for those individuals. But they're doing it really on their terms. They're doing it when they can be available. They're doing it at a price point that makes sense for them. And ultimately, it makes a lot of sense for us as well.
Yeah, the huge thing for me, a former healthcare professional, was being able to work, close to my home, right? I didn't want to necessarily get up and travel to another market, or take a travel contract. I wanted the flexibility to work, at home, right? And I wasn't a single parent, right? I was just trying to pay debt down. And so, I mean, of course, we're super excited, to enter Seattle and Portland and California with y'all and help these healthcare professionals out. How do you think, the definition of flexibility has changed in the workforce? Because when I was a nurse, working locally in the healthcare systems I worked at, pretty much had to commit to a hospital, right? You had this like full-time work model, even when I was per diem per se, I had to work Sunday nights, I had to work holidays, I had to work, day shift, night shift another week. There was a lot of restrictions. And then the other thing that was a pain point for me as well was when they didn't need me, they would wait until a couple hours before the shift, and then I get scheduled, and then I'm at a loss of income, right? And so, how do you think the definition of flexibility has changed? What has the pandemic done to this definition? I guess the catalyst here to change it.
The pandemic and the workforce crisis is making the definition evolve. And you hit it right on the head from your experience as a nurse. What the definition used to be is we'd like you when we'd like you, where we'd like you. And the pandemic and the crisis is changing it to how does it look for you to be able to work with us? And I think that's really important. And this crisis isn't going to end with the pandemic. We know that 10,000 Americans turn 65 every single day. And even more to the point, the average age of retirement during the pandemic is lowered to 62. So we know that that's just going to continue to grow. We also know that the replacement rate, the birth rate, is nowhere near what we need to fill all the positions that we have. And particularly in healthcare, where what we've seen is, we're at right now about 40% of all the positions that healthcare posts actually get filled. It's an all-time low. So the reality is that the definition of flexibility has to look a lot more like the caregiver's definition. I want to be able to work when it makes sense for me. I want to have advance notice of when you need me. I want to make sure that I can have a schedule that can be innovative so that it meets both needs. And I think ultimately that definition creates a win-win-win.
Yeah.
It's good for the employer to have loyal workforce members. It's good for our caregivers, our employees, to know that we can work with them. And ultimately, it's really good for the communities and the patients that we serve.
Yeah, we've talked about this before. I mean, this is huge for me, right? Yeah, and you mentioned this before too. It's not about just like adding more people, right? There just, quite frankly, aren't more caregivers out there. I mean, we do have, I think is it 80,000 new grads every year coming into the industry, but it's not just about adding more people. It's about thinking about demand of our patients holistically, and how do we better match that demand and the supply of professionals in real time, right? And so to do that, you just alluded to this, we really need to meet the professionals where they're at with flexibility and make it easy for them to pick up shifts when they're needed by patients. And then the healthcare system wins, right? Because they're getting flexibility and they're able to have cost savings associated with that. And then the patient population wins because the care provider is there when they need them. And then, of course, the healthcare professionals are winning because they're picking up shifts on their schedule. Which is what I always wanted, and what a lot of single parents and people in school and retired folks and people that have to take care of loved ones really need. So I'm with you. I think we do need a win-win-win model, and I think it's now's the time, considering all the dynamics. What do you really envision as the future of work in healthcare? How do you see Providence evolving for the future as we move to more of this outpatient and at-home model, and patients not necessarily being in the hospital?
Yeah, it's a great question, Will. I think that the first thing that I think about is how we're going to need to evolve our talent ecosystem. Again, to meet people where they are. I don't see the trend changing of people going to the sidelines. I don't see the trend changing of people wanting to have flexibility. Even outside of healthcare, we've seen, over 500,000 people incorporate as their own business. We've seen Pinterest, just explode with, virtual stores, if you will. So I don't really see that changing. And so I think we have to expand our talent ecosystem and really think a little bit more holistically about when might we need a traditional agency rotation? Where do we think we need our own employees? And where can we actually take work and bid it out to a gig workforce to meet people on their terms? So I actually think that for healthcare, it really kind of expands what's available. I couple that with the fact that we'll always have, that we're really going to have to be mindful of how the jobs are designed. So in order to be attractive, whether it's through a traditional agency rotation, through our own caregivers in our workforce, or with this great arrangement with CareRev, at the base, have we designed the job that allow people to do their best work, and where have we allowed technology or automation to enable them to do their best work? So I think it's how we tackle it, because to your point, I don't think we're not going to fill every opening. If we're only filling about 40% of the openings today, I don't see anything between now and 2030 that says that's going to rise. So we'll have to be a blend of expanding the ecosystem and really using technology to enable. And I actually think this is a great time for us, because particularly in healthcare, when we start to talk about technology to enable or to automate, it sounds like code for layoff. I just don't see layoff in this environment. I see us looking at how we fulfill and let technology be that enabler of it. But it's really about shrinking your demand forecast. It's not about layoff.
Yeah, it's about, I believe we talked about this before too, but it's about empowering your workforce. How you mentioned to me that oftentimes staffing managers and nurse managers will have multiple different systems they're having to log into to figure out, staffing, and then they have spreadsheets on the side and they're doing group huddles, and there's no real like centralized staffing solution for them, or where they can get an idea in real time of what's going on with their staffing inside their healthcare system. And I think that's a huge opportunity, as you mentioned, to bring technology into. So it's easier to schedule and staff people for true patient demand, and then unit managers, of course, will be able to get off of scheduling and managing people to supporting patients and their staff while they're there. It's not about laying people off. It's about empowering people so they can be better care providers and support the care providers that work for them, not spend half the day trying to figure out what the schedule should be.
That's exactly right. And Will, I think you're hitting on a critical point. And it's one of the things that I really appreciate about what you're doing with CareRev is, some of what we have to make sure that we're doing right away is enabling our leaders to make their best staffing decisions. And it's about creating the right insights, but even more importantly, it's really about creating better technological connectivity so that you can see, and really kind of breaking down some of our platform barriers. It's one of the things that, that I like as we start looking at our further engagement with CareRev. The platform that you've built really allows us to look at how we bring in the workforce on the sidelines, but we can also then connect it to a view with our own internal workforce to understand where there are openings, how do we push out openings to our external workforce and to our colleagues with CareRev to really see it holistically. And I think that's one of those critical elements. Leaders have so many things on their plate. We were actually doing some work at Providence with our clinical leaders on reducing administrative burden. And we recognize that our leaders have to access over 30 different platforms to do their work. So when we think just about staffing and scheduling, which is a considerable amount of the work that they do, what if you could really collapse that down to one or two platforms? And so I think in addition to how you're helping us connect to the workforce on the sidelines, you're also helping us to connect externally and internally so that we have one clear view. So that's one of those areas that we haven't done as much work yet, but where I'm really excited to start to explore what that could look like.
So Mark, as it comes to implementing this workforce solution and the strategy you're doing now, how's it going? Has it been good, or has anything bad happened? How's the process going?
It's been great, Will. Where I want to start with this is what we've enjoyed is that we're learning from each other. And, I think of a couple of examples as we've gone into implementation. And for some people, this will probably sound a little off, but it was really critical. CareRev taught us that it's really more convenient for the workforce to look at a 9-panel drug screen. Well, we had a 10-panel drug screen. So when we looked at it, what we found is CareRev was right. It's a lot easier to find a provider who can provide a 9-panel drug screen than it is a 10-panel drug screen. So that's going to save us time in provisioning. And it's something that we're already looking at and bringing to the rest of our workforce. So that was really significant. we had done some really nice work in providing electronic medical record training online. So we were able to share that with CareEv so that they can bring that to other of their partners. So I think that's really been, really good for us. Two things that called to mind for me. One is how CareEv is helping us shift our thinking. When we started in this engagement, we thought, well, this will be fantastic. We'll find people that want to fill 12-hour shifts. And the CareEv team reminded us that if you're looking for flexibility, you might have to be open that you won't get the full 12-hour shift filled. So as we were talking with our nursing leaders, we asked the question, will you feel comfortable if we release a shift, but we can't fill the whole 12 hours? And I'll never forget, this was Michelle James, our executive director of clinical operations, who said, Mark, some portion of a 12-hour shift getting filled is better than 0% of that 12-hour shift getting filled. And if this is what will bring people to the sidelines and off the sidelines, and will provide the care that we want to provide, then let's do it. There's no reason why we shouldn't. And when I heard that from Michelle, who is a really trusted advisor to me, became really clear that this is a great path. And what we're seeing as a result of that openness is that in our first phase in Western Washington, we've provisioned close to 93 healthcare professionals in the Seattle area. They're ready to work. And what we know is those 93 professionals are going to fill hundreds of shifts for us. And what we also know that is they had a great experience with us at Providence, based in part with the things that we learned from CareEv and we've adopted to make provisioning fast and easy. They're going to recommend this to others. And so I think we'll see exponential growth in the number of healthcare workers who want to work through this method. They're going to have a great experience. They're going to fill lots of shifts, and we're going to provide that great care to the community. We're going to give our own caregivers a lift because they know that we have the right people with the right skill set right next to them. So I think in all cases, this has been off to a really good start.
Yeah, I mean, I'm really thankful for Providence as well, because you brought to the forefront of a lot of conversations around burnout. And we hadn't been having conversations like that with healthcare systems before. It's predominantly around how do we bring people in their door at all, and how do we get them off these fixed costs? But when I first met with Sil, one of the things he mentioned that y'all were doing was really looking at your staff overall and how you could reduce burnout. I mean, I believe he had programs in place where he was calling people to check on them and their mental health. And I've just been super impressed, with that innovation and that mindset at the corporate level and how that plays down. I think, these 93 people that you've met, you're going to retain them. I think the culture of treating people well and trying to retain them and reduce burnout is huge in this industry right now.
And I think it's a great call. Well, first I will say we've done amazing work in well-being. I'm so proud of Providence for what we're doing. It's just so aligned with our mission. And, we've made a lot of investments over the course of the pandemic because they were the right thing to do. And well-being is huge. And I think to your point, we're excited to welcome these 93 healthcare workers. And we're excited to welcome them, whether they at some point decide they want to be Providence caregivers, or if they say staying on the sidelines and having this flexibility is what's best for me. If that's what's best for their well-being, then we want to support it.
All right. Well, thank you so much, Mark. Super excited to chat with you and work with you, and looking forward to our next conversation. Really appreciate it.
Thanks, Will. Appreciate the time.
Yep. All right. Bye, Mark.